Welcome to our comprehensive guide on understanding the benefits and side effects of Ozempic. If you or someone you know is living with type 2 diabetes, you're likely familiar with the challenges of managing blood sugar levels and finding a treatment that works effectively. Ozempic, a prescription medication, has gained popularity as a potential solution for those seeking better control of their diabetes. In this guide, we'll delve into the various benefits of Ozempic, such as its ability to lower blood sugar levels, promote weight loss, and potentially reduce the risk of cardiovascular events. However, we'll also discuss the potential side effects that users may experience, including nausea, diarrhea, and injection site reactions. By providing you with a comprehensive understanding of both the positives and negatives, we aim to empower you to make informed decisions about your diabetes management. So let's dive in and discover all there is to know about Ozempic. What is Ozempic? Ozempic, also known by its generic name semaglutide, is a prescription medication used for the treatment of type 2 diabetes. It belongs to a class of drugs called GLP-1 receptor agonists. Ozempic works by mimicking the action of a hormone called glucagon-like peptide 1, GLP-1, in the body. GLP-1 is responsible for stimulating insulin secretion, reducing glucagon production, a hormone that raises blood sugar levels, slowing down gastric emptying, and promoting a feeling of fullness. By mimicking GLP-1, Ozempic helps regulate blood sugar levels and can contribute to weight loss. Ozempic is typically administered as a once-weekly injection using a pre-filled pen device. It is important to follow the prescribed dosage and administration instructions provided by your healthcare professional. How does Ozempic work? Ozempic works by binding to GLP-1 receptors in the body, which are mainly located in the pancreas, stomach, and brain. When Ozempic binds to these receptors, it activates them and triggers a cascade of physiological responses that help regulate blood sugar levels. One of the primary effects of Ozempic is the stimulation of insulin secretion from the pancreas. Insulin is responsible for lowering blood sugar levels by facilitating the uptake of glucose into cells for energy production. By increasing insulin secretion, Ozempic helps reduce elevated blood sugar levels in individuals with type 2 diabetes. Another mechanism of action of Ozempic is the inhibition of glucagon secretion. Glucagon is a hormone produced by the pancreas that raises blood sugar levels by promoting the breakdown of stored glucose in the liver. By reducing glucagon production, Ozempic helps prevent excess glucose release into the bloodstream, further contributing to blood sugar control. In addition to its effects on insulin and glucagon, Ozempic also slows down gastric emptying, which means it delays the movement of food from the stomach to the small intestine. This delay in gastric emptying can help regulate the absorption of glucose from food, preventing sharp spikes in blood sugar levels after meals. Lastly, Ozempic acts on the brain to promote a feeling of fullness and reduce appetite. This can lead to decreased calorie intake and potential weight loss, which is beneficial for individuals with type 2 diabetes who often struggle with obesity and weight management. Overall, Ozempic's multifaceted mechanism of action makes it an effective tool for managing blood sugar levels and promoting weight loss in individuals with type 2 diabetes. Benefits of Ozempic. Ozempic offers several benefits for individuals with type 2 diabetes. One of the primary benefits is its ability to lower blood sugar levels. Clinical studies have shown that Ozempic effectively reduces both fasting and postprandial, after-meal, blood sugar levels when used as an adjunct to diet and exercise. By achieving better blood sugar control, individuals can reduce the risk of complications associated with diabetes, such as kidney disease, nerve damage, and cardiovascular events. Another significant benefit of Ozempic is its potential to promote weight loss. Obesity is a common comorbidity in individuals with type 2 diabetes, and losing weight can significantly improve diabetes management and overall health. Studies have demonstrated that Ozempic leads to greater weight loss compared to other diabetes medications. The exact mechanisms behind this weight loss are not fully understood, but it is believed to be a combination of reduced appetite, delayed gastric emptying, and increased calorie expenditure. Furthermore, Ozempic has shown promising results in reducing the risk of cardiovascular events in individuals with type 2 diabetes. In the SUSTAIN-6 trial, which included over 3,000 participants with cardiovascular disease and type 2 diabetes, Ozempic demonstrated a significant reduction in major adverse cardiovascular events compared to placebo. This finding suggests that Ozempic may have protective effects on the heart and blood vessels, making it a valuable treatment option for individuals at high risk of cardiovascular complications. In summary, the key benefits of Ozempic include improved blood sugar control, weight loss, and potential cardiovascular protection. These advantages make Ozempic an attractive option for individuals with type 2 diabetes who are looking to optimize their diabetes management and reduce the risk of associated complications. Side effects of Ozempic. While Ozempic offers numerous benefits, it is important to be aware of the potential side effects that may occur with its use. Common side effects of Ozempic include nausea, diarrhea, and injection site reactions. Nausea is one of the most commonly reported side effects of Ozempic. It usually occurs within the first few weeks of starting the medication and tends to improve over time. If nausea persists or becomes severe, it is advisable to consult your healthcare provider. Diarrhea is another side effect that some individuals may experience while taking Ozempic. Like nausea, it often resolves on its own as the body adjusts to the medication. However, if diarrhea is persistent or accompanied by other concerning symptoms, it is important to seek medical advice. Injection site reactions, such as redness, swelling, or itching at the injection site, may occur with Ozempic. These reactions are usually mild and transient, but it is essential to follow proper injection techniques and rotate injection sites to minimize the risk of irritation. In rare cases, more serious side effects may occur with the use of Ozempic. These can include pancreatitis, inflammation of the pancreas, gallbladder problems, and thyroid tumors. It is crucial to be aware of the signs and symptoms of these potential complications and seek immediate medical attention if they occur. It is important to note that not everyone will experience side effects with Ozempic, and the majority of individuals tolerate the medication well. However, it is essential to discuss any concerns or potential side effects with your healthcare provider to ensure appropriate management. Who should take Ozempic? Ozempic is indicated for the treatment of type 2 diabetes in adults. It is typically prescribed for individuals who have not achieved adequate blood sugar control with lifestyle modifications, such as diet and exercise, alone or with other oral anti-diabetic medications. Ozempic is not intended for the treatment of type 1 diabetes or diabetic ketoacidosis. It is important to consult with your healthcare provider to determine if Ozempic is the right treatment option for you. Your healthcare provider will consider factors such as your overall health, medication history, and individual treatment goals when making a decision. Pregnant or breastfeeding individuals should not use Ozempic, as its safety in these populations has not been established. Additionally, individuals with a history of severe gastrointestinal disease, such as gastroparesis, or a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, MEN2, should avoid using Ozempic. Dosage and administration of Ozempic. The recommended starting dose of Ozempic is 0.25 mg once weekly. After a minimum of 4 weeks, the dosage can be increased to 0.5 mg once weekly to achieve better blood sugar control if needed. The maximum recommended dose of Ozempic is 1 mg once weekly. Ozempic is administered as a subcutaneous injection in the abdomen, thigh, or upper arm. It is important to follow the instructions provided by your healthcare provider on how to use the pre-filled pen device correctly. Proper injection technique and site rotation are crucial to minimize the risk of injection site reactions. It is important to establish a regular dosing schedule and adhere to it to ensure consistent blood sugar control. If a dose is missed, it should be taken as soon as possible, unless it is close to the time of the next scheduled dose. In that case, the missed dose should be skipped, and the regular dosing schedule should be resumed. Precautions and contraindications of Ozempic. Before starting Ozempic, it is important to inform your healthcare provider about any existing medical conditions, allergies, or medications you are taking. Certain precautions should be taken with the use of Ozempic to ensure safe and effective treatment. Individuals with a history of pancreatitis or a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia syndrome type 2, MEN2, should not use Ozempic. These conditions can increase the risk of complications associated with Ozempic use. In some cases, Ozempic may interact with other medications. It is important to inform your healthcare provider about all the medications, including over-the-counter drugs and supplements, you are taking to avoid potential drug interactions. Ozempic may also affect the absorption of oral medications taken at the same time. It is recommended to take oral medications at least 1 hour before or 4 hours after the administration of Ozempic to minimize potential interactions. Individuals with a history of gastroparesis or severe gastrointestinal disease should use caution when using Ozempic, as it may further delay gastric emptying and worsen symptoms. Regular monitoring of blood sugar levels and periodic evaluation of kidney and liver function may be necessary while taking Ozempic. It is important to follow up with your healthcare provider as recommended to ensure optimal diabetes management. Frequently asked questions about Ozempic. Can Ozempic be used in combination with other diabetes medications? Yes, Ozempic can be used in combination with other diabetes medications, such as metformin, sulfonylureas, or insulin. Your healthcare provider will determine the most appropriate treatment plan based on your individual needs. How long does it take for Ozempic to start working? Ozempic starts working within a few hours of the first dose, but it may take several weeks to achieve maximum effectiveness. It is important to be patient and consistent with the medication for optimal results. Can Ozempic cause hypoglycemia, low blood sugar? Ozempic has a low risk of causing hypoglycemia when used alone. However, when combined with other diabetes medications that can lower blood sugar, such as sulfonylureas or insulin, the risk of hypoglycemia may increase. It is important to be aware of the signs and symptoms of hypoglycemia and take appropriate measures to prevent and manage it. Can Ozempic be used for weight loss in individuals without diabetes? Ozempic is not approved for weight loss in individuals without diabetes. Its use should be limited to the treatment of type 2 diabetes under the guidance of a healthcare professional. Can Ozempic be used during pregnancy or while breastfeeding? Ozempic is not recommended for use during pregnancy or while breastfeeding. It is important to discuss alternative treatment options with your healthcare provider if you are planning to become pregnant or are currently pregnant. Comparing Ozempic with other diabetes medications. Ozempic belongs to a class of medications called GLP-1 receptor agonists, which have become an important treatment option for individuals with type 2 diabetes. Other GLP-1 receptor agonists available on the market include Trulicity, dulaglutide, Byetta, exenatide, and Victoza, liraglutide. While these medications share similar mechanisms of action, there are some differences in terms of dosing frequency, side effect profiles, and cardiovascular outcomes. Trulicity and Byetta are administered once weekly and twice daily, respectively, while Ozempic offers the convenience of a once-weekly dosing regimen. This can be beneficial for individuals who prefer less frequent injections. In terms of weight loss efficacy, Ozempic has demonstrated superior results compared to the other GLP-1 receptor agonists. The SUSTAIN-7 trial showed that Ozempic led to greater reductions in body weight compared to Trulicity. When it comes to cardiovascular outcomes, Ozempic has shown significant cardiovascular risk reduction in individuals with type 2 diabetes and established cardiovascular disease, as demonstrated in the SUSTAIN-6 trial. Trulicity and Victoza also have cardiovascular outcome trials showing cardiovascular risk reduction, making them attractive options for individuals at high risk of cardiovascular events. The choice of GLP-1 receptor agonist should be individualized based on factors such as dosing frequency, weight loss goals, cardiovascular risk, and personal preferences. It is important to discuss the available options with your healthcare provider to determine the most suitable medication for your needs. Conclusion and final thoughts on Ozempic. Ozempic is a prescription medication that offers several benefits for individuals with type 2 diabetes. Its ability to lower blood sugar levels, promote weight loss, and potentially reduce the risk of cardiovascular events make it an attractive treatment option. However, it is essential to be aware of the potential side effects, such as nausea, diarrhea, and injection site reactions, that may occur with its use. Consulting with your healthcare provider is crucial to determine if Ozempic is the right choice for you. Your healthcare provider will consider your individual needs, treatment goals, and medical history when making a decision. Remember that effective diabetes management involves a comprehensive approach that includes lifestyle modifications, such as a healthy diet and regular exercise, in addition to medication. Ozempic can be a valuable tool in achieving optimal blood sugar control and improving overall health and well-being for individuals with type 2 diabetes. Thanks for watching.